Morning.
Okay, got it.
Okay. Good morning, everyone. Welcome to the Adult Daycare Services Working Group. I'm really excited that you're all taking the time to be here. I first learned about some of the challenges that adult daycare were facing through the daycare center in my town. And as we talked more and talked with Rep. Hughes and other people, we saw this developing, that there were some issues and we were fearful of closing, etc. So we did this working group to move quickly to see, what could we do to help this situation. So I'm glad you're all here. And with that, I'll hand it over to my Vice Chair, Ann Hughes, to do some welcoming comments also.
Thank you, Madam Chair Garipe. Yeah, we're very concerned with the closure of a number of our adult day programs during the pandemic. And we felt like the legislature really needed to help form a working group to figure out some sustainable funding resources to not just keep our adult day programs, but expand them, because there's such a vital service for folks staying in the community, especially folks with dementia. And getting the socialization and the nursing and support and food and all kinds of resources that they need to stay home. It's a lot more economical option than certainly going into a long-term care facility, but it's also more beneficial often for the client to not just be sitting at home one-on-one with an aide all day. So we're looking really a part of the goals of this is to expand awareness, especially to legislature, about the need for funding streams and resources, and also to find out how we can look at sustainable ongoing resources to expand these services across our communities, because we know that the population of dementia residents is growing and the services are not keeping up. So we're finding ways to meet people's needs wherever they are, and that's going to be a challenge, including transportation. So I welcome you all, and I'm eager to hear what your sort of stakeholder role is in this landscape, and how we could be really strategic and get some good work done for recommendations for the legislature when we begin in January. So. Yeah, I'll turn over to Jane to pick on people to introduce themselves, I suppose.
So you're the people with the expertise. Each of you comes with super qualifications. Some of you are living it. And everything is on the table, that we keep open minds to every suggestion and try to come up with some action items at the end of our work together. I would like to ask each person to introduce themselves and talk a little bit about, your professional background. Cheryl, do you want to start?
You have to unmute. There you
Good
go.
morning. My name is Cheryl Rosenbaum, and currently I'm the coordinator at the Caring Connection Adult Day Center in Windsor, Connecticut, where we are the only municipal program left in the state. I sit on the board of the Connecticut Association of Adult Day Centers, where I am membership chair and secretary, and I know firsthand the number of centers that have been closing during the pandemic, and even right before, when we were feeling the effects of what was happening with regard to getting people into our program and assistance that is really needed. I've been at the Caring Connection for 10 years, 5 of which I have served as the coordinator, and all of my professional life has been with caring for elderly, first in long-term care and then in adult day. Thank you so much for this opportunity, and I really look forward to the work we can do together.
Thank you, Cheryl.
You're welcome.
Chrissy.
Hi, good morning, everybody. My name is Chrissy Scatini. I'm here as the Vice President of the Connecticut Association of Adult Day Services. I'm also a member of the board of directors of the National Adult Day Services Association. And I've been in Adult Day for over 20 years. My group has owned and operated 10 programs between Massachusetts and Connecticut. And we've been working here in Connecticut for the last, almost 5 years now. My background is actually only Adult Day Services. It's something that I am very passionate about. And we have done different types of model programs, and I've been glad to be part of the Connecticut Association and work with the programs that have been in Connecticut for many years. And I've gotten to see firsthand just how extraordinary they care for seniors and all the services that we can provide. So we're all glad to be part of this group, and thank you so much for bringing us together. Thank you.
No, thank you. Joy. We'll come back. Sherry.
Good morning, everyone. I'm Sherry Ostroud. I'm the Director of Government Initiatives at Connecticut Community Care. Julie Evans Starr, our president, wishes she could be here, but she is en route on a red-eye flight back from California, so she'll join the next time. Connecticut Community Care is an access agency for the state of Connecticut, administering and coordinating, doing assessment and care management activities for the Medicaid waiver programs, as well as the Money Follows the Person demonstration programs. We have the role of educating and facilitating access to the adult day centers. I personally have been with Connecticut Community Care and in this role for, believe it or not, friends, 29 years. And it's shocking to me too. And have always seen adult day centers as a vital service for our community, not just for those with dementia, but for those who need or enjoy more social engagement, activities, medical oversight. It's a terrific option. And I just want to applaud our adult day centers during the pandemic. For those who've made it, the pivoting that went on and the creative solutions that went on with the legislative support as well was really something to admire. Happy to be here, happy to represent CCC and do what I can to support this work.
Thank you. Mag Morelli.
Hi, Meg Morelli. I'm from Leading Age Connecticut. We represent the not-for-profit providers of aging services throughout the continuum. So we have several nonprofit adult day center members, but we also provide management services to the Adult Day Center Association. We've done that, Adult Day Services Association, I apologize. We've done that for many, many years. Happy to thank you for allowing us to serve on this task force. We've been working on these issues for a long time and working with CADS. And I think that Sherry touched on something, that during the pandemic, there was a lot of flexibility and a lot of innovative ideas that went forward with the state support, and that maybe we can draw some, from some of that experience and things that we can move forward to assist the clients of the adult day centers who find it so valuable. And I think we also need to touch a little bit on, how do we get the word out to the public that this is an option and an opportunity? So really pleased to be on here, and thank you both so much for convening this. We appreciate it.
Thank you. Melissa.
Thank you. Good morning. My name is Melissa Morton. I am with the Health and Human Services Policy and Planning Division of the Office of Policy and Management. And I think the piece of my position that brings me to this group today is that one of my roles is to serve as chair of the state's long-term services and supports planning committee, the long-term care planning committee. It's a statutorily required committee made up of legislators and the various state agencies that are involved in health and human services across the state. And part of our charge is every 3 years, we develop a long-term services and supports plan that actually takes the temperature of the state's long-term services and supports landscape and the work being done by agencies, and it defines gaps and areas for improvement, both fiscal and programmatically and quality-wise, and puts forward a set of recommendations for the next 3 years for the state to advance its goals in improving the full spectrum of long-term services and supports available in the state, of which adult day centers is a critical piece. So I'm here in that capacity, looking at it from the view of where it fits into the entire continuum of long-term services and supports.
Thank you, Melissa. Margaret?
Good morning. I'm Margie Girondo Marquette, the manager of the State Unit on Aging with the Department of Aging and Disability Services. And I'm also part of the Long-Term Services and Support Planning Committee that Melissa mentioned. So the State Unit on Aging has about a dozen federal and state supported programs and initiatives, and we look to support older adults, their families, and caregivers with a focus on healthy aging, caregiver support, elder rights, and long-term services and supports. And just to tell you about a couple of our programs that are relevant here, because I think that's what you're looking for. We have 2 caregiver programs that provide short-term respite services. One is our National Family Caregiver Support Program that's funded under the Older Americans Act, federal funding. The other is the Connecticut Statewide Respite Care Program, and that's state funded. And adult day services is a critical service under both of these programs, especially the Connecticut Statewide Respite Care Program, where we see a lot of people availing themselves of those services. It serves families with loved ones with Alzheimer's. So these programs are small in comparison with what DSS has for the Connecticut Home Care Program and other waiver programs, but we really see them as often used as a bridge to get to those programs as people are looking and exploring their long-term options and also applying for those programs. I also want to mention that we provide state-funded support through the area agencies on aging for adult day centers. And it is a small amount of money, but we're happy to have it. And just recently, we were able to do one-time only funding using American Rescue Plan dollars to double that for a particular year. So we look to provide support where we can, and we know that this is an affordable, safe option for people. We want to do what we can to keep providing this and making sure that adult day services remain an option for families. So we're very happy to be part of this group. Thank you.
Thank you so much. Mary Pat?
Hi, good morning, everyone. I'm Mary Pat DiCarlo, and I am here representing the Connecticut Nonprofit Alliance, as well as the Kennedy Center, which is located for the most part down in Fairfield County, Bridgeport, Trumbull area. I think my background is a little bit different from everybody else because my focus has been on the population of those that are developmentally disabled and intellectually disabled. But one of the things that we've been finding out, Kennedy Center has been around for over 70 years, and we've been serving people from childhood through seniors. And we are finding now that we have a lot of seniors who, yes, they have a disability, but they are not a lot different than the other seniors. And we are presently providing services in the day program side to over 250 individuals, and 30% of them would be considered seniors. So I think looking to the future and what type of collaborations we might be able to do, or experiences that we've had that we can share, we'd just like to be a part of that.
Okay, thank you so much for being here. Zani,
Sorry.
good
Hey,
to see you. Been a long
good to-
time.
Good to see you, Representative Garibay and Representative Hughes. Thank you. It's good to be on this work group. And so I'm here at this time in a role with OPM, with the HHS division. I'll be covering the Aging Committee and a couple other HHS-related committees for the legislative team. And so I look forward to whatever this work group comes up with, but also helping you guys out. So I'll keep it short. I think we all know each other. So, well, I know a few of you. So yeah, thank you.
Thank you. Melanie?
Oh, hi. Good morning, Representative Garibay. My name is Melanie Flaherty. I'm not an official member of this working group, but I'm just here to observe. I do represent the Connecticut Association of Adult Day Services, along with Joy Avalone. Joy is traveling and is unable to connect today to the meeting with video, but she's listening in. We're happy to help if you have any questions, but we're just following along, and we thank you very much for having us.
Okay, thank you. So Joy can't speak to us?
No,
No,
she
that's
can't.
okay. Welcome.
Thank
Yeah,
you.
that's okay. And I just want to mention Cameron Clark, who's our clerk and an integral part of this team, so that we have records. And we thank him for being here and facilitating this meeting.
Hey,
So with the welcome,
Representative Garibay, I think Dawn Lambert was trying to join too with her co-lead. Is she not here? I can't see everybody.
he's not here.
Okay.
No, I'm here.
Oh, you
there
are. Okay.
Yeah, sorry.
Sorry.
I joined a little late, had some computer issues this morning, but I'm here. Thank you. And Jen
Okay.
will be here at the next meeting, or she might join a little bit later. So,
Okay, you want to introduce yourself,
Introduce
Dawn?
yourself, please.
sure. So Dawn Lambert, I co-lead the Community Options Unit in Division of Health Services, DSS.
Thank you. Well, thank you all for being here with all the expertise and the talent that we have in this Zoom room. Hopefully we'll be able to come up with some good ideas. And someone mentioned that it's not just Alzheimer's, which is true, although the early onset Alzheimer's is becoming an issue. But there are so many that can benefit from this, and it does help the working families, because if they don't have a place for their loved one to go during the day, they're going to end up in nursing homes, which is not what is an option for some, but it should be a choice, and not if we have people living at home with their families that want to stay there, we'd like to help them to do that. So our overall goal is to come up with some ideas that we can put into legislation to keep our adult daycares thriving. With that, we're opening it up for discussion.
Yeah, I think we want to frame this part of the discussion about kind of like our overall goals, and then we want to figure out how frequently this group can meet in the next few months, and the duration, and how to be incredibly strategic about those meetings, about which kind of stakeholder groups or focus areas that we want to do, which Jane and I will figure out after the meeting to help set the agenda for the next working group meeting. But we wanted to kind of get your thoughts, and also make sure that we open up at least some of the meetings to consumers, their advocates, and families that are really struggling to get services.
But can we talk now just about what some of our goals would be, what you would see from your different perspectives?
Yes.
What some of our goals would be in this group?
Well, I can just jump in for a quick second. As the Adult Day Association, we've had set some priorities of how we would rank the difficulties what the industry is having, and the number one is enrollment. So our biggest goal throughout this project and others is to expand enrollment of adult day centers and expand the base of folks that are eligible to enroll and participate in adult day centers, so that we can continue to serve folks in the community and assist their families, those with Alzheimer's, those with different types of diagnosis, and essentially that's pretty much our top priority, and that's why we're excited to be part of the group.
Great goal.
Great. Thank you very much. Anybody else? Melissa?
May I just ask Chrissy a follow-up question? Can you just elaborate on your comment about a desire to expand the base of people eligible to enroll? What specifically you mean by that? Did you have?
Right now, the programs that state funding that is options that are available to people for enrolling in adult day service is mainly through the Connecticut Home Care Program, through the smaller but very valuable respite program, and a few other funding sources. One of the options that we were hoping to explore is a possibility of allowing it to be part of the Medicaid state plan, where folks can, if they're on Medicaid, as it is in many other states, actually most states around New England as well, that folks that are on Medicaid are eligible to choose adult day services if there's a need, based on they'd have to qualify through criteria to qualify for adult day services with assistance of daily activities of daily living, different diagnosis, things like this. But to allow them to choose adult day service as an option, whereas I believe the representative had mentioned some options right now include nursing home placement and home care. And there's, other supports available, but we'd like to make adult day service an option for anybody that would, physically qualify.
Thank you.
And just to put out, what challenges would we have in expanding?
I think we have to go through MAPOC, right?
Well, yeah, so I can, if it's Medicaid, is that a question to Medicaid or is that different? Are you talking about expanding as a Medicaid benefit or expanding in some other covered way?
Let's start with as a Medicaid benefit.
So as a Medicaid benefit, adult day is already in our state plan for people over the age of 65. So that means it's an entitlement. There's no waiting list. And it's for people not yet at nursing home level of care. So in some ways, the state's Medicaid state plan is more progressive than even some of the other New England states, because we don't require that people are at nursing home level of care. Such would be the case like in a PACE model, right? So there's that. But the age grouping for Medicaid is 65 and over. So you don't have to be at nursing home level of care. It is an entitlement. However, it's 65 and over. That's the way that the program's built. Unless you're a participant in the, for people who have brain injuries or a participant for the DD system. And then you do by kind of diagnosis. But for people with physical disabilities, they don't have, absent the other co-occurring like a brain injury or a developmental disability, they do not have access under the Medicaid state plan. So they don't have a benefit that covers adult day currently in the state. I don't know how much demand there is for people under this at the age of 65 for adult day. I think that's a question. That's an important question because Representative Hughes, your question is like, what would the challenges be? We would have to estimate what the costs would be to expanding that. And that of course would be based on our assumptions around demand. I don't know. So if we create the supply, what kind of demand would come to the door? That would be for DSS to try to figure out. And I don't know, Chrissy, have you done any like surveys to the general population to find out whether that's a benefit that they're interested in? And Margie, you've been serving people under the age of 65 with your programs. I'd say that a slim wedge, but still you might have some anecdotal kinds of observations about 65 versus 60 versus 55.
I'll just
Oh,
answer. No, I was just going to answer first and then ask Margie. But so we have done some work with representatives from DSS over the last year. We've had a standing meeting where we have explored some of these questions, and we based it our our calculations, or I shouldn't say calculations, our estimates were based on the utilization of services such as home care, nursing facility, and things like that for people under this age of 65 right now. And so if we considered that those folks would be given the option to choose adult day services, there was some rough estimates provided. Unfortunately, I don't have that information right in front of me, and we'd have to probably work to get it accurate. But that's what we were using as a basis for this assumption that there are, people age 60, 58, early onset Alzheimer's, people with MS, people that are, physically disabled without a brain injury per se, and folks that use PCA service or other types of programs. If we use that as the population to offer them adult day service. As far as the specific demand, most of those folks in the state may not be aware that adult day would be an option. So we would have to probably, a survey would be a great idea, like you mentioned, or find some way to let them know about the service and then see what a viable option it would be for folks that have the need already. Sorry.
Okay, I do have Mary with her hand raised, and then we'll go to Margie.
Yeah, I just had a quick question for clarification for myself. When we say Medicaid state plan, is that Medicaid waiver?
No. So the way that Medicaid's like an insurance, right? So Medicaid's an insurance that targets individuals in certain groups. We call them groups. And there are a lot of different groups that Medicaid covers. So when we say state plan, that means it's in the basic benefit of the state, of the actual insurance. So it's while waivers are kind of like add-on services. So that's what the term actual waiver means. They're waiving that access to waiving the comparability of the benefits. We have to fairly offer the benefit to anybody who's eligible, except if we've waived that comparability in order to provide additional services for certain people who need more services. So waivers are like carve-outs. The state plan is the basic insurance, but it becomes an entitlement. So there's a fundamental difference, because if you carve out like a waiver, you can establish caps, like states have permission to do that. So we might say we're going to serve 100 people under this waiver, and the state has no obligation to serve more than 100 people. If it's in the basic insurance benefit, it's an entitlement. So it's the same as us saying, well, you're not eligible. You can't use any more hospital days on your insurance. Well, of course you can. If you need a hospital, you expect to be able to go to the hospital. That's part of your basic benefit. There's no carve out there. Works the same in Medicaid, basic benefit, hospitalization, community first choice is an entitlement that does give access to supports and services, all ages, for people at nursing home level of care. So we already have that as an entitlement in the state that give people a benefit in lieu of institutionalization. Anyway, so basic benefit means entitlement. It's part of your basic benefit package, versus waiver is just for a certain targeted group, and we can limit access to it.
Okay, thank you.
Thank you for that clarification. Margie?
Yes, so in terms of the Connecticut statewide respite care program, we do have eligibility of someone with Alzheimer's or related dementia of any age. So I can get some statistics for you, which may help, as you said, Dawn, on a small scale, and maybe we can compare it to the percentage of the people that we serve overall. For our National Family Caregiver Support Program, we do serve people under 65. It's usually 60 and over. There are certain exceptions, including people with Alzheimer's. So I can get statistics for both programs, some data, and share that with the group.
Okay, so my question is, do we have services in the state that would serve a 50-year-old person with MS that is living at home with working caregivers, but cannot stay home alone during the day? I know we have, there's healthcare that can go in for a couple of hours, a nurse, aides and all that. But is there anything that's comprehensive that would allow the family members still to continue to work, whether it's a husband, maybe elderly parents, but they're still working? Do we have services for that population?
we have Community First Choice as part of the basic Medicaid benefit that we were talking about before. It's an entitlement. There's no waiting list. We have the PCA waiver to the extent the individual is eligible. That PCA benefit waiver, as I mentioned before, because it is a waiver, it has some additional limitations that Community First does not have. Like it has a waiting list and it has a limit on the dollar value that we can fund that individual at in the community, versus Community First Choice is based on need. But if we otherwise would give access to an institutional environment, the state is required to fund the person in the community. So it's a benefit that came out of like the Olmstead rebalancing to say, create equity in your state so that people have a choice between community or institutional care. So it is a wraparound, Representative Garvey. And, you know, you could receive 24-hour live-in assistance under that waiver, or the scenario that you're painting where maybe the spouse is home at night, the member doesn't want 24-hour support. They do not want somebody else living in their house. It would be according to their needs so that they could stay home. It is a self-directed benefit, so it doesn't have a wide range of options. It means that the person with a disability or their representative would be the one who would be hiring the staff who would be coming into the house. So it's a maximum choice, flexibility, and autonomy. That's what we call it. It's maximum choice, autonomy benefit, but it is not an agency-based approach where you would call the agency and the agency would send someone. You could receive that benefit though, if you need it at the same time as like nursing services. That's an example. So there are other entitlements in the state that do support people. So if you have medical needs and also needs with bathing or dressing, you could get both of those services to help you stay at home.
What about those that don't have, in visiting my adult daycare, you know, I met people that, you know, they can walk, they're cognizant, you know, they might not qualify for that level of care. Does that make sense? But they shouldn't be around a stove. You know, they might be a little wobbly, shouldn't be home 8-9 hours. Are those people also eligible for that type of care?
Well, so you do have to be at nursing home level of care.
Okay.
Right. So I don't know if the individual, but that does include an assessment of need for supervision.
Right.
Which may be the person that you're talking about, but it's hard for me to know, you know, whether it does or not. And it could just be the need for supervision, which makes it a little bit different as an entitlement than some of our other, like home health, for example. You need hands-on assistance. That's how you get access to home health. But it could just be for the individual that you're describing, but we probably need to do an assessment to determine.
Right.
And Dawn, I see Sherry's hand is up, but can you just tell us, is there a waiting list for the PCA waiver right now? Yeah,
Yes.
and how big is that?
The PCA waiver wait list, let me get back. It's certainly more than a year. I believe that it could be, it's a couple of years. I have it. Let me just revisit and we'll get that. Jen may know. Jen's responsible for the waivers, so she might have that right offhand. Last time we checked in, it was a couple of years, because once again, the state can limit access to waiver programs. Now, we don't limit access to the home care program because we have a state policy that's a no waiting list policy. So the waiver allows us to at a federal level, but the state has adopted a no waiting list policy. So that's the reason there's no waiting list, because we always fund prospectively enough slots to address whatever the demand might be. So
I'm just thinking one of the goals of this group could be a quick map of the needs assessment out there, which, you know, we'll pull from that. We'll pull from a bunch of different areas to try to see what is the needs. And like somebody said earlier, I don't think the public understands this, you know, this resource, this service that's potentially available, and then how to fund it is a whole different thing. But yeah, go ahead.
Thank you. Sherry?
Great, thank you. And before I jump in, Mary Pat, I think you were before me and maybe your hand has come down already. All set, okay.
She's all set, yeah.
Okay, great. Representative Hughes, you're headed in the direction I was going to suggest in terms of a goal, is looking at the quantity of adult daycares, the location of them, and the location, geographic area in which transportation is available. What we find is that the places that we know that statewide workforce is an issue, right? We know that there's significant issues in terms of serving people in their home, and I have no doubt that that is true for serving people in adult day centers as well. However, what we find is that the places in which we have the biggest shortages in the workforce, and this is anecdotal, it's not based on data specifically, is also where there are no day centers, right? So one of the questions I would have is, where are the day centers located geographically? What is the geographic span in which the transportation is available? So that's one goal. Now, just a comment related to the impact on day centers during the pandemic and the reopening and people coming back. We find that people are really, people were serving, older adults, people with disabilities, and their families are very reticent in going into congregate settings still, even with incredible assurances, policies in place that are well communicated related to vaccines and boosters. There still is some real hesitance in heading back into communal settings. So that is definitely a reality. The other thing, prior to the pandemic, we also experienced with many people a desire to receive in-home services rather than congregate type services. And that has to do with personality. That has to do with just preference. Some are introverts, some are more social, but the personal nature of the care planning certainly has to take that into account, even with the best education and championing of the adult day center experience. So I think that this group could also maybe provide some experience of people who may be attending who fit that personality profile. I'm not even super clear on what I'm trying to say here, on how you can still go to the day center and experience privacy. You know, what is the day in the life of being in a day center? And what is the experience like with the staff? And, you know, there may, sometimes it's just being able to visualize what that experience is going to be, and taking that first step is the hardest, because once folks are there, often what they experience is a very, very positive thing.
I couldn't agree more, Sherry. I hate to jump in here, but I work in a nursing home, but the adult day program, community facing services, is in the campus. And I all the time try to bring folks from the community down to take a look at it. And of course, they all say usually, oh, I'm not one of them. I don't have that kind of dementia or whatever. And don't see that just getting out of the house rather than sitting home all day with a potential caregiver who's just there to, you know, administer meds and serve, maybe serve a meal, but that's so different than activities, interaction. And we do have a memory care workshop that's for, for people that are just coming to really work on their early memory issues, and it's very, very robust and very engaging, and people just have those chance to get out of the house and have activities and have socialization and have encounters with recreational staff and others. But that entrance into that service from first glance, where you think you don't belong, it's a bias that we have to overcome for everyone.
thank you. Sir, go ahead.
Thank you. I just wanted to piggyback on what Sherry had shared about looking at the quantity and location, the geographic location of adult day centers, and also looking at capacity. So we know that during the pandemic, capacity changed and was limited. And now, you know, with opening up, looking at when we go to refer, making sure that that's there. So balancing the needs of consumers also with the location and the capacity at the location as well, and trying to figure out how to make that work the best. So just wanted to offer that.
Yes, thank you. Cheryl, could you talk a little bit about what you do specifically at your daycare to reach out to the community about what you do,
Sure.
what the daycare provides?
So the Caring Connection, our outreach is through social media, through individual referral sources in long-term care facilities as people are discharging. We hear from CCC regularly, although we would love it to be even more regular, with recommendations of people who have expressed some interest in adult day. And as an association, we are working on a training piece, which should be out in the next few months, that will talk a little more specifically and can be used by anyone about what adult day is all about. So when people inquire, we bring them in for a meet and greet. We give a tour. We talk about free trial and having the experience working with the person and the family to figure out how we want to avail them of our specific service, the number of days that would be appropriate, and just fitting them into our program. Our program all day long is a variety of activities that focus on both the physical and the cognitive needs of clients with choice. You don't have to participate in every single activity. You can observe, you can do some independent activities that you are interested in that we can help you set up or adapt what you used to be able to do and now want to try and do them again. We're very choice and individually focused. However, the group, for the most part, operates as a family, as a group. In addition to what is being done by our clients, we have the support of the nurses and the personal care services and the nutrition, and just the community feel of being together with others who are living similar lifestyles.
I know you also do open houses because I've been to them before
Oh,
COVID.
sure. So
You know,
we do open
outreach.
houses. Again, being a municipal program, we're on our town's website. We all have Facebook pages and other forms of social media. People can go to websites to help them know about their programs.
You also visit other communities because you've done senior gatherings with me.
In our particular area right now, we are entering into a phase of a lot of adult day health fairs. And so we're invited to different senior centers in the towns that we transport to, and are able to have a table and talk firsthand to people and show people exactly what it is we offer. I just would like to make one comment that has been mentioned. I think many centers around the state have space right now. And also that every center is different. We look different, we feel different, we operate differently under the same guidelines. Personally, transportation is a huge piece of what we are talking about.
Yep.
Because
access.
it's access to transportation and cost. And the cost of transportation lately has been astronomical. And so we have to figure all of that in as well. We have lost centers. That there is no doubt about that. I get calls from people from outlying communities where there used to be centers. Unfortunately, we can't offer transportation to, but families are willing to transport. Not all, because I get the same calls from people from towns where it's an elder person taking care of an elder person and they aren't able to transport. So I believe that transportation is a factor, and it is something we need to take a look at, because as a medical model center, some of my Medicaid clients, if they had to go to a doctor's appointment, which was also medical, Medicaid paid for their transportation. They come to my program where they see a nurse every day and have all of their needs met, and I have to find the money for transportation as well as meet all their needs through my nursing staff. Are there any other specific questions that I can talk about? Or Chrissy, if you want to jump in if I missed anything?
No, you described everything eloquently. Thank you so much,
Yeah.
Cheryl. Thank you.
Yeah, thank you, Cheryl. Melissa has her hand up.
Thank you very much. And I'm so glad, Cheryl. I want to thank you for addressing transportation because that was going to be part of my comment. The other, I think that's a big barrier, and I'm glad you brought it up. The other thing I did want to address was that in the development of our current 3-year long-term services and supports plan, we solicit feedback from the public, from advocacy organizations, but also this time we sent a survey out to actual consumers who utilize long-term services and supports, and we held a series of focus groups. One of the things that came up about adult day centers was literally people not using the service because of the name of the service. And I know that that sounds silly, but to the baby boomer generation or to parents of now it's aging parents with aging children with intellectual and developmental disabilities, all of them being over 50 years old, the term adult day is so demeaning and insulting to them, is what was shared, that it feels like they're putting their parent in a daycare, which is not an appealing, from a marketing standpoint, is not an appealing title for some of, particularly the baby boomer generation. So I just wanted to pass along that was some of the feedback, was just the general branding, even if we have to call it that for, our Medicaid reimbursement purposes, and that is in fact what the service is. Some thought on how to overcome that stigma so it doesn't feel like I'm an adult going to daycare, which some people are finding as a stumbling block.
No, you're
Thank you.
absolutely right.
100%. I was just going to agree with that as well. We've actually, our program, we call it an adult day program, an adult day center. We stay away from the words daycare at any and all cost, even though we use it for our billing code, of course. But when we, market our center, we approach people, we call it a day program, a day center, a great place to be, but we find you're absolutely 100% right. Nobody wants to go to daycare. Yeah.
Yeah, thank you for that. I think I've been calling it an adult daycare, as when my mom went years ago to the Caring Connection, but that is a good point, and I have heard that. Are there any other comments?
Jane, I'm thinking, I don't know if we have, so we have another big agenda item to decide our schedule and the duration of the meetings, but it does seem to me like we're talking about needs and geographic mapping of what we have, and I don't know.
It's just going to go over the list of things that we came up with.
Okay, great. And I don't know if we have.
We do
time
have
to-
a hard stop at 10:15 today, but we will get to that. But some of the things that I heard, and Ann, you can add on, is that some of the tasks, we need a needs assessment. Where are our daycares? the transportation issue for daycares, staffing issues are, what's happening in adult day centers, and promotion. How do we get the word out? Did I miss anything of the key?
Funding.
Well, funding, that's the overarching,
Yeah.
if we had
We'll
money,
get to
we wouldn't
that,
be here. If we had, and what is the best way to do with what we have, et cetera. And Karen is doing up notes for this, and it'll also be up online if you want to go back and see the meeting. So we were thinking,
We've
that we
got
could
3
do-
hands up, though.
three hands, I'm sorry.
Yeah.
Yes, just a second. Who's first there?
I think Dawn, then Mag,
Dawn.
then Mary Pat.
Yep.
So thanks, Representative Garabay. So I have the same list and actually was just about to do the same thing, but also to add that out of the things that have been discussed so far, none of those, if those are the key challenges or the key problem areas, I'm not sure that any of those require a legislative change, right? It sounds like it might be something different, that maybe it's a discussion about the way that the rate is developed for adult day, because as Cheryl mentioned, that sounds like that's a huge barrier, but the rate is embedded. I mean, the department does take into consideration the cost of transportation when they build the rate. So if that needs to be revisited, that's more of a discussion
Right,
about
absolutely.
what the actual rate is. It's not really a legislative,
Right.
A legislative change. But I didn't hear anything that might raise to it. It could be that we need to expand and make it more permissible, but it's across the entire Medicaid state plan, broaden the benefit. But it seems to me, based on what I've heard, that the key challenge is drop in demand with the existing benefit. So if that's true, that might be where we start, which is to try to regain. I hear there's capacity. I hear people are not choosing it anymore. I guess what I wonder is, have the preferences of the population actually shifted so that the demand for that type of service has gone down as it was originally configured, not as, the new vision for Cheryl or Chrissy. I mean, I can imagine adult day centers, what used to be being tech centers, or being like specific to some folks. That would be very, very exciting for members. It feels different. It is different. And it doesn't have any of what some folks might have in their mind about adult daycare, right? So it just shifts the image totally. And it might be within the existing portfolio. Anyway, I haven't heard anything so far that says we should expand the state plan to people under the age of 65. But Margie, I think your numbers will be really important, because if you actually have a waiting list for people under, if you have a significant waiting list where people, because that is the front door for under 65 adult day is your department. So if there's a lot of demand coming through that way for people that are Medicaid eligible, I don't know if we can share data, that might convince me that it's the way to go. But otherwise, I'm just not sure the demand is there.
Okay. Thank you. Mag?
Sure, there were a couple things that happened, or at least one important thing I think that happened during the pandemic, and that was the ability for the day centers to connect with people who couldn't make it into the center, to do check-ins and to deliver the meal that they would have had, been planning on, and things like that. And just wondering if we can maybe at one point have a discussion of if people found that to be successful, what the consumer satisfaction was with that, what are the benefits of that, sort of the continuity of services, particularly the food piece, the food security, and the almost like a backup to not being able to make it into the center for whatever reason. The center was closed, or the person can't make it in that day, they're not feeling well, whatever it might be. But I think that might be something we want to sort of look at and analyze. Since it did happen, we have some experience with it.
Right. And before I move on, in talking with the adult centers, it is an issue, what they are paid for per person per day. When you have a full-time nurse on staff, all the different things, it was like $72 a day reimbursement, and that's your 2 meals, your transportation. So that is part of it. And we'll go more, but I'm going to go on to
I think Mary Pat's next.
Mary Pat. Yep, Mary.
Just a thought, is there ARPA money available through the state right now for some new initiatives or to look at doing things a bit differently? I know that in the DDS world, one of the things that we're looking to do is to re-look at our assessment tool. And I know that they're looking to use some of those ARPA funds to do that. So I didn't know if that was a possibility for those funds to be available for some of these initiatives.
That's a great question.
It is a great question, and I don't know the
I don't
answer. So,
We can find out. We got people.
We have, so you have the 2 ARPA administrators here. Jen just joined, and Jen's
Okay.
responsible for some of the funds, the 3 million, right, Jen?
Yes, that's correct.
And there are also initiatives under what we call ARPA 9817. That's the HCBS money that can address things similar to what Mag's talking about. And we actually have a conversation pending Friday, I think, on that very subject. So there are other work groups and other things going on that might be helpful for this team to consider because we are working on some things.
right. Okay, anybody else? So who would you like to hear from as soon as, well, let's first decide when we're going to meet next. We were talking about either twice a month for an hour and a half each time. So let's say the 2nd and 4th Tuesdays, 9 to 10:30, or we could meet once a month for 3 hours. I will tell you my preference is twice if people can do it. 3 hours seems like a long conversation. Any thoughts? And it's only for a couple of months.
I'm all for the twice a month, especially Tuesday mornings are good for me.
Is there
We're
anyone that disagrees with twice a month? Okay, is there anyone that cannot do Tuesdays 9 to 10:30?
Cheryl, can you
Cheryl?
say some more about that? You gotta be, yeah, unmuted. There you go.
Yeah, I'm just concerned, I'm an observant Jew and several of the major Jewish holidays are on Tuesdays in September and October. And so that would be difficult for me to be able to attend on that day, Monday or Tuesday.
Understood.
Is there any other day that would be good for everyone? Or any days that would not be good? Maybe that's easier.
I'm available
Wednesdays
any
are
day.
hard.
Oh, sorry.
Wednesdays are hard for me, but any other day I can work around.
Yeah,
Thursdays?
Wednesday.
Okay,
Wednesday.
Wednesdays are difficult, so Wednesdays are out. What about Thursdays?
Could we do a Tuesday, the first week, the first two, whatever, and a Thursday, the second one? Would that be acceptable? Cheryl, could you make that second one for sure? I mean, maybe even the Tuesday, but I don't know.
I think Cheryl's saying all Tuesdays are bad, right?
Fourth one in September and the second one in October.
Are bad. Okay, so maybe
Is
we
there
could
a
do the,
preference from everybody whether Tuesday or Thursday? Melissa?
Thursdays are,
Thursday
I have
works.
2 standing Tuesday morning meetings on the 2nd and 3rd Tuesdays, so Thursday's far preferable if at all possible.
So can everyone do Thursdays 9 to 10:30?
Yes. Yep.
It's better to keep it on just one day,
that's true.
I
for
agree.
me anyways, to know Thursday mornings, Okay, so that's perfect. So it'll be
Thank you.
the second and fourth, thank you, Cheryl. Second and fourth Thursdays, 9 to 10:30. So who, at least for our next meeting and beyond, what guests would you like to have come to talk to us to get more information or to clarify? There's been a couple mentioned. At some point, we do want to hear from people. Someone mentioned about having people that go to daycare centers. Is there anybody else?
If I don't know if we have time, but I think it would be really valuable for this group to do a little bit of a needs mapping and geographic mapping to see where the gaps are. And I don't know, I think we almost want to see that before we see, but I could be wrong. Maybe that's not the right.
Well, it was just getting an idea of who in the next couple of months that we would want to
Sure.
hear
I think we
from.
need some advocates.
We
and
know
users
that we
and
need
families.
the tasks where a needs assessment,
Mhm.
where are our daycares, and I'm sure Chrissy can help us with that, right?
Yes.
You
Yep,
know where they
absolutely.
are.
We
You
have
know,
that
and
all.
maybe just a little description of, you know, what kind of a care center are they? Adult center are they, et cetera. The
Yeah, I
staffing
want to hear from
issues.
families. Yeah.
Yep, from
Families that are using it or not using it because barriers.
and the actual attendees.
We have a few families on our waiting list that are, their family members are under the age of 65 and they're desperately seeking assistance. So we could invite, and also we have a few, I don't know if you'd be interested in physician's office that are constantly trying to refer us folks that are also under the age of 65, but we're unable to accept them.
Okay, we'll take down the ideas and then come back at the next meeting. Who has the information to do a needs assessment? Where would we find that needs assessment?
I think maybe Dawn and OPM, we can work together, right? I don't know.
When you say needs assessment, you're saying an assessment of the demand for services,
Yeah.
services for people under the age of 65?
No, not necessarily under 65, just across.
In
you
general.
know, In
Got it.
general, yeah. But I mean, the map is going to be really important. We get that, right?
Mhm.
So we can see where the geographic gaps are. But who can pull the metrics of like the utilization rate has gone down through the pandemic? Like we're saying, maybe we're shifting to an emerging needs model that is different from pre-pandemic. I did hear that we should also, from MAG, that we should talk about which programs were able to support people in their homes, because that's still the adult day providing service, even though they didn't come in. And then, you know, transportation and access, which is not just transportation, but how to get through the maze to get the services is the whole nother barrier area. But
Right.
don't know
Chrissy,
who
do
can
you
help us.
know, are you back to pre-pandemic capacity?
No, most centers
No.
aren't. Some centers are seeing an increase, luckily with the good weather and summer, summer weather and outdoor activity options. A lot of programs have seen increase over this recent season. But we suffered a lot of loss of members. We have a lot of members that were moved to institutional settings and are no longer available to come to the programs. As far as people that were participating and are now just staying home, that number still exists, but luckily is getting better. But we still haven't quite resumed our pre-COVID. A big part of that does include transportation, because we don't we can't offer the same mode of getting to the program where it fits into somebody's schedule, because with the limited number of vans and you're only filling them maybe halfway, the timing isn't what it used to be for somebody. So it may not work with their family member, with their home care schedule, things like that. So there's a lot of factors to that.
Right. And I know there was a lot of communication through COVID and talking with Cheryl of doing Zoom meetings with, you know.
So we provided some Zoom programming. We delivered activities along with the food and the phone calls that we made every day to every family and their caregiver through the pandemic when we were closed. And even once we opened, we were able to keep some of those people on that service because that met their needs.
Right.
That's amazing.
Nice job. But Chrissy, can you also, when you're doing, you know, where the daycares are they for-profit, nonprofit, municipal? Like, I didn't know we were the only municipal daycare. But it'd be interesting to have information like that too, to do. So is there anything else that someone wants to comment? I just want to say thank you all. You're a wealth of knowledge.
Mag has her hand up. We can't see
So
her
take-
hand because it's like
Oh, I'm sorry.
white against
Yeah.
the white.
Sorry.
Sorry.
I just, and I don't want to put somebody else on the spot, but anecdotally, and not to, have to create data, but to get to an adult day center on the waiver program, you use the access agency, right? The access agency puts your case together. And so they are sort of the witness to what some of the barriers are to people choosing adult day. Like Sherry said, the opinions of people. So maybe even if there were a couple case managers from one of the access agencies who could just talk about what, people's reaction to adult day and,
Good idea.
what they view as some of the barriers to it, it might help us as we're looking at that piece of it. But Sherry, I don't want to put you on the spot, and I don't,
No.
I don't think you have that data, but just more, I'm thinking more personal, anecdotal.
Right, we can certainly do that. I'd be happy to gather a couple of care managers who can share that information. I also noted that Mag put in the chat here the map of adult day centers who are part of the Adult Day Center organization. That's very helpful and a good base to start from. I think an overlay on that map and the centers is identifying if they participate in Medicaid reimbursement, specifically Medicaid waiver programs. A number of the day centers who are part of the association, they're not providing services to Medicaid waiver participants. So we may want to overlay that data with that.
I don't think that's too many of them though, right, Chrissy? But that would be
Not
good.
many.
Not anymore. A lot of those centers are the ones that have closed.
Got it. Okay, thank you.
But you're right. There is some. We should definitely take a look at it though.
Mhm. Thanks.
One other idea we had mentioned back in our thoughts about the group is, if interested for a speaker, we could bring somebody from the National Association who could speak to models of different states and how these challenges have been met and how enrollment and state plans work in other states. And being on the board, I could provide you with some potential folks that may be helpful for discussion.
That would be great. So the whole idea is to have choices for seniors. A nursing home is not for everyone. A center isn't for everyone. Home care isn't for everyone, but for the elderly to have choices about where not everyone can age at home. It's just not feasible. There's no relatives, whatever it is, to help provide choices. And I hope that within this group, we can find ways to give better choices at our adult centers. So any last comments before we, again, thank you so much.
We'll be in touch, right, Jane? We'll be in touch with
Yep, we'll send out
schedule,
minutes.
Yep, minutes and calendar invites, and we'll focus, we'll let you know what the focus of the next meetings will be, and so we can prepare and invite the appropriate people.
So our next meeting will be September, no, there's not another, a Thursday in August,
Right. It'll be September.
right? So we will go to the 8th. September 8th will be our next meeting, but we'll send out a schedule of the dates. Okay. Anything else? Thank you so much for being here and for sharing all your expertise. It's a powerhouse committee. I'm looking at all of you and I'm just so impressed with all your knowledge and caring, and I look forward to working with all of you.
Thank you.
Thank you.
Thank
you
you.
very
Y'all
much.
have a great day.